Hello everyone, myself Dr. Sarfraz Robert. I'm the IELTS and OET expert. Today I came up with another inevitable video regarding the OET speaking sub-test. OET is the test where we will have our speaking module as well. Now let me introduce you the OET speaking sub-test. We will be having two role plays, and these role plays are basically two consultation role plays. We will be given 3 minutes to read the role play of the setting of the role play and the task according to the scenario. Now we will given 3 minutes to read about that role play, and then we will be given 5 minutes to speak about the task in the role play. Now 3 minutes to read the role play and 5 minutes to speak about the task which is given in the role play. Now, how our speaking in the OET is going to be assessed. One must know the rules before he or she is going to play the game. Now, the rules are two. We have two examination criteria in relation with the OET speaking sub-test. The first criteria is called the linguistic criteria. Here, examiner assess your speaking in terms of the language you speak with the patient. Now, this criteria contains four steps. On the other hand, the second criteria is called clinical communication criteria, and that is our today's topic. I have given detailed video about the linguistic criteria. You can watch in my previous videos, but today's task is about the clinical communication criteria, which is the second criteria in order to know the OET speaking sub-test. Now, clinical communication criteria, 1C, second C, and third C. I call it 3C. So 3C criteria is clinical communication criteria. What is the meaning of clinical communication criteria? The meaning of clinical communication criteria is not only about your delivery of speech. It is more than just your delivery of speech. It is more than just your delivery of speech. Now, it is not just only how you communicate or how you deliver your sentences to the patient. It is more than just the delivery of your speech. How you are going to start your conversation. That is really important in terms of clinical communication criteria. The second thing, in order to understand the term clinical communication criteria, is how you start a conversation. It depends upon the scenario. If you have given a task where patients are waiting for you and you came late and patients are anxious and they're agitated of you being late, so you need to start your conversation by apologizing. However, if you are the GP of your patient and the patient and you have a good relationship, you're not going to start your conversation by saying, "Hello, my name is Dr. Sarfraz Robert. I'm your physician today, and what is your name?" You're not going to introduce in this way. You're not going to start your conversation in this way. However, you're going to start that this is the problem. This is the problem. Now, we will learn in detail how we are going to start a conversation in different setting, in different scenarios. That is the second one. The third one is how you interact with patient or their relatives. Means that do you have the communication skills to interact with the patient or their relatives and answer their questions. Fourth one is you need to check if someone needs additional help. For example, if someone requires additional help regarding the scenario, you need to know what they are demanding in their condition. So these four things are coming in the clinical communication criteria. This is to give you the definition of 3C. Now, let me introduce the five 3C criteria, mean the clinical communication criteria. Number one is relationship building. What is mean by that? Like how you are building your relationship with your patient. Is your patient comfortable talking to you or not? The second thing is this, that understanding and incorporating the patient's perspective. What is mean by that? Simply that, do you really understand your patient, or your patient is understanding you? That is the meaning of understanding and incorporating the patient's perspective. The third criteria is providing structure. How you are providing your sentences, how you are using your vocabulary in clinical communication. The fourth criteria is information gathering. What ways, what type of questions you're going to ask to the patient in order to gather the selective or relevant information. The fifth one is information giving. How being a doctor or a nurse or a pharmacist or a physiotherapist, how you're going to give relevant information to the patient. So these five criterias are coming under the domain of clinical communication criteria. These five criteria will test you on not just according to your level of knowledge of the English you have. They are going to assist you by the communication skills. You truly need communication skills in the healthcare setting. Means that how you're going to value the patient through your communication, how you're going to value the healthcare professionals in your communication, and how you're going to prove that your employers are going to really rely on you when you're communicating with patients. Another important thing I would like to say here, clinical communication criteria are language based. You are not going to be assessed by your medical knowledge here. Guys, I want to tell you honestly that you truly need communication skills clinically in order to pass your OET speaking subtest according to these five criteria. So in the upcoming videos, I'm going to give you detailed information about each criteria of clinical communication criteria, how we're going to deal in this exam according to the demand of the examiner. If you want to know more about the OET, or if you want to take my online session, please do communicate with me and I will help you to pass your OET exam. Thank you.